All right. Anyway, so I'm recording now. Is that okay? You see where that is now? And if anyone else had that.
Yeah, thank you.
Yep, you're welcome. So I did like repeat. So for unit 1, which is chapters 1 through 4, the PowerPoint lectures are all in this folder. And then I did repeat that just so that you had easier access. I repeated it for next week too, but you can always just go back and pull from here. I don't know if it's more confusing to have duplicates or what, but anyway, the lecture, so the recording is here, PowerPoint in my voice, but the actual, just the PowerPoint lecture is in that folder, okay? And then you'll see there's case studies. This is really just like some PDFs of the tables that are in your text, because they, for whatever reason, it's really hard to get like a picture of the table. So like if I took a picture of my phone, it looks totally crappy to put into PowerPoint. So sometimes I refer to them and tell you guys to look at it in the book. Also, like in the chapter 1 recorded lecture, I pulled up the table that I was referring to from the e-text. So you could always still see it and like pause it and look at it more closely in the recorded lecture, okay? So it's there, but that's what those are. Those are just like PDFs of some things in the textbook that I necessarily, I can't really get a good, like I can't get a JPEG file of, and so they look like crap if I try to take a picture and put it in, or even if I try to scan it, it just doesn't come out nice. Okay, so that's what that folder is, just so you know, while we're sort of on this. Let me go back to that. Okay, and then there is a folder with case studies in there, and we will start to refer to them in class. Sometimes I might assign it as an assignment or something like that, but we'll start to go through those case studies. So they're all there basically for each unit. You'll see there's a folder with case studies. Okay, so you can kind of take a look at some of those on your own if you wanted to. The answers, no, they're not in the back of the book to the case studies. But regardless, if you had we would go over them if I assign one. But if you did one on your own and you have a question about it, just email me and I can, you know, we can, if you're not sure like what the answer is, just let me know. So there's kind of some extra ones in there is what I'm saying, but we will also work on those together and as assignments. Any other questions about kind of anything in Moodle or anything like that? Okay, so the one thing I wanted to show you was the, in terms of office hours. So if you just click, I mean, if I just click on the office hours there, I did update that. So you'll see that I say here, like for us, right? Like after our class, I'll just stay on our Zoom link. It's super easy. Just ask me questions, whatever you need to do. Once everyone's kind of done asking questions, I'll probably close that out, right? So, but sort of off days of when we're not right around our class, I'm going to remember when I'm working to just log into that virtual office link, which is at the top. I put that there. And so then you can just kind of pop in and just ask me a question and I should be there. Now there's a chance that I might not be there. If that's the case, just shoot me an email. I'll just be like, hey, are you there? But I wanted to try, so I will, you know, I will do my best to always be there, but that's essentially when I'm giving you certain times when I'm available, but you know, I'm available outside of that as well. All right. So where it says use virtual office link, then you would just click on this link right here. Okay. So just make sure for class meetings, you're clicking the class meetings link, and then the virtual office is that link. Okay. Is that clear to everyone? Yeah. Does anyone have any questions about that or anything? Okay. So I wanted to show you guys that. So what I'm going to do first is I'm going to pull up the chapter 1 lecture. And like I said, just to highlight a couple things, and then we'll sort of move on from there. And then I'll let you know, I'm probably going to leave you, I sort of most likely will sort of run out of time. So I'm probably going to leave you with doing something on your own for chapter 1 in that review sheet, but we'll see how it goes. Okay. All right. So let me, I believe I have this already open. Yeah. Okay. So again, I'm not going through the whole PowerPoint again, right? I mean, that's the whole reason why I record them ahead of time. So I know that, you know, we cover it and you guys can spend as much time as you need to yourself rather than me covering it here. So one thing, I guess this kind of, first sort of information slide, the idea, so yeah, in this chapter, there's a lot of like just little terminology in terms of definitions. So Yeah, you should know them. So in fact, when we do the review sheet for chapter 1, it's probably just like some terms and definitions, and that's fine. But really what this chapter is meant to do is really to introduce the textbook and just provide sort of broad kind of information that's going to be really applicable to kind of everything that we cover through the semester, okay? So just kind of think of it that way. It's not necessarily getting into the nitty-gritty details. It's just really kind of taking a broader approach. So the one big thing here, especially, as nursing students, we want to make sure that we can understand the why behind disease, right? So that's really what pathophysiology is. So we talk about, a disease and maybe what symptoms and signs that patient might present with, but really in this course, we want to understand why. What we may not necessarily, a lot of times you don't really know the actual cause of the disease, right? But we know what the cause of the symptoms is essentially, right? Or we know what's being affected, like on the cellular level, what's actually sort of causing that disease, but we don't know what caused the initial change on the cellular level, right? Like a lot of times we say we don't really know what caused that, like we can't actually repair that, but we need to know what that is, right? We need to know what's leading to this set of symptoms, okay? So it's really the kind of why are these symptoms happening, as opposed to, this disease means this, these symptoms means I give them this medication, right? It's really understanding more of what's going on biologically, right? So anyway, that's one kind of important main concept to always think about as we're moving through the semester, right? We want to understand why something's happening, okay? Because that makes us better clinicians. Does anyone, and so anyone has questions, unmute, interrupt me, or a comment or anything like that. Anyone have any questions? All right. So that was one thing I just wanted to kind of point out. A couple others. So, again, more terminology, speaking about pathology versus pathophysiology. So we really think about pathology. It's really looking at those structural changes that are happening in the tissue, right? Or some other specimen, what have you. And then a kind of more specialized discipline of that is histology, where you're actually looking, again, maybe at tissue, and then looking at the specific cells in a tissue using specific stains and other kinds of techniques, right? And so one other thing, I guess, to bring up, if you're going to know if something looks abnormal, you have to know what it looks like normally too, right? So again, you got to know that sort of basic sort of structure and function behind it, and then know when it looks abnormal, okay? So these are all subdivisions kind of pathophysiology, or fields that sort of feed into it and help understand a disease, okay? All right. The other thing I wanted to bring up, and this kind of goes along with that tape. So I was just mentioning those tables, right? And that I put this PDF of this table in Moodle. I showed you that folder. I also, again, in the recorded lecture, show you it in the e-text because it's much more clear that way. Okay, so that table that's in there, that table 1.1, is really just meant to be, again, overview, right? Showing you these main concepts and then these sub-concepts that are related to it, and then what disease it could potentially lead to, okay? So again, this is broad and this is an overview. Nobody needs to memorize anything in that table, but we're gonna kind of, the book is sort of organized in that way, okay? And so to kind of go further with that, if you look at this diagram here, you'll see a lot of these in the textbook and as we move through, all right? And this goes along kind of with that table, right? It's kind of talking about sort of broader concepts and then sub-concepts that then ultimately affect something like a heart attack, okay? So let's just, you can just kind of go through this a little bit here. So if you're talking about metabolism as sort of being just the main concept in general, right? You can have effects on metabolism caused by, say, diabetes, okay, which actually can influence the thickness of the blood, okay? So the blood's thicker to begin with, right? If you go over here in this inflammation part, again, this is the broader concept, right? What could cause kind of, there's many causes or things that can increase inflammation, right? One thing that can happen if we're talking about related to a heart attack is that you can get, if you have really high lipid levels in your blood, right? You get that, those get stuck in the walls of the blood vessels. what that then does, it's not even, when you get a blockage, it's not only just the lipids that are stuck there, it's also the inflammatory process that triggers. That then causes the blood vessel to constrict even more. And so if you have lots of lipids around, you got extra inflammation, constricted blood vessels, and you have thick blood on top of it, what's going to happen, right? Why do we have perfusion here next? What does this mean? If somebody just wants to answer that. What do we mean here by perfusion? And how do those things affect perfusion?
That's the blood flow.
Yeah, it's the blood flow, right? And so I just kind of give you examples of how that blood flow can be restricted, right? Okay, and then so somebody else, when you have then problems with blood flow, why do we now have this sort of subconcept here of oxygenation?
Low oxygenation.
What do you mean by that?
You're not getting as much oxygen from the blood into your system. It's not flowing.
So where's the oxygen? So right, so the oxygen, right, normally oxygen is transported, it's transported in your blood, right, being bound to hemoglobin. When it gets to the capillaries, where does it go? Because you don't need to, the oxygen really doesn't serve any purpose sitting on the hemoglobin, right? You know, circulating through, it needs to, where does it need to go?
It's supplying the organs and muscles tissue.
Correct. Yep. And so in this case, we're talking about heart tissue. So what particularly in the heart tissue where is that oxygen going?
Through the veins and arteries, or?
Well, so it's in the, right, arteries, and then it essentially is going to go to the capillaries, right? And then that oxygen is going to leave the capillaries and go essentially across the blood vessel wall into the interstitial fluid. And what's going to pick up the oxygen? Cells, right? So those cells are the ones, and we're going to talk here, maybe we can think about this, heart muscle cells, they need oxygen in order to contract, right? If they're deprived of oxygen and also glucose, right, other nutrients, what happens? They can't work anymore, heart attack, right? Cells end up dying, and depending on how many cells die, that then will affect, right, if you talk about like a mild heart attack versus a more severe, it's really dependent on how long those cells were deprived of oxygen and how many cells were affected, right? So just, again, that just brings up the point where we got to think about the cells, right? That the oxygen, because there's a block of blood flow, right? That blood doesn't get into the capillaries. It doesn't then get to those cells. And then those cells die, heart stops working, heart attack, right? Okay, so does that make sense, everyone? So you can kind of see how all these things are interrelated. So the idea, again, isn't really about like memorizing all these things. So like, if you saw something like this, maybe on another topic, hopefully like as we move through this course, you can kind of reason through it the way I sort of just did without having to know every little nitty gritty detail, because you're not going to. Nobody does, right? Like nobody, no scientist, no doctor knows every single nitty gritty detail about everything, right? But as long as you have this sort of basic understanding, you can sort of reason through things, and then you can find out those nitty gritty details as you need, right? But just know that so that's the kind of idea, and that's really what this first chapter is kind of meant to do, to kind of get you thinking like that, okay, if that makes sense. So it's really not right now about memorizing detail. And the way, again, I told you, like, the questions that I ask on the exam are these NCLEX types questions. They don't necessarily ask straightforward nitty gritty detailed questions. It's more like, here's the scenario, kind of, and then you're choosing sort of an answer based on this scenario, right? They're more applied knowledge rather than straight recall, okay? So anyway, there's another example here, and I won't go through this one completely because we just went through that one because I don't want to run out of time, but this one is has to do with an asthma attack, right? And so again, showing you broad concepts and then some of the sub concepts that are then related to it, okay? So like if you think about this yourself, like try to maybe, whatever, you can talk to yourself if you want, right? Reason kind of through this and kind of describe, how does genetics affect inflammation? Why is there an arrow from obesity to inflammation, right? And again, you may not have all those answers right now, but that's fine, because we're going to learn about that as we move through. right? So again, this chapter is really meant to kind of for you to think about things in this way. Okay, does anyone have a question? No, everyone's okay right now? Okay. So like I said, you'll see these as you move through, okay? The book. All right, some of the, then I'll probably skip through some of these. I wasn't worried about highlighting this too much, but a lot of this is terminology, right? Health versus illness. I think the one thing to think about is a lot of times people use sort of illness and disease, interchangeably, but really when we talk about an illness, it's bringing in the patient's feelings, right? It's subjective to the patient, okay? So you could have a disease, but not necessarily feel ill or be ill, okay? So, or you can have an illness or feel ill and not necessarily have a disease, right? But like I said, a lot of times we kind of use them interchangeably, but when you're thinking about illness, it's really that subjectiveness, if that's really a word. All right, and then the other thing here too was just it again. I kind of introduced this in the recording. I won't go through it completely, but it's kind of looking at these three patients and kind of thinking about some of the concepts we're talking about, like acute disease versus chronic, right? You're talking about different patient populations, an infant versus an adult, right? So there's a lot of things to kind of think about. In kind of within here, and again, not meant to memorize anything, but just to kind of think about all these things that might affect illness or disease. Okay, so that's why we brought up those three examples. All right. The other thing, talk about risk factors, right? And I think I kind of in the recorded lecture say, hey, can you think of any other modifiable risk factors? So I guess I could ask you guys now. So somebody giving me an example of another modifiable risk factor you can think of.
Drinking.
Yep, drinking, good. What else?
Exercise habits.
Yep, good. Exercise habits, that's a good one.
I don't know if this would be one, but would sleep habits be one?
Yep.
Like sleep schedule?
Yep, definitely. That's a good one. What else?
Assuming that you have access, hygiene.
Okay, good. And I think it's good that you said assuming that you have access, because that sort of brings me to a next point. I mean, if you think about these modifiable risk factors, right? Like diet, like hygiene, I guess in what case might you consider them non-modifiable, or give me some examples where they may not be able to be modified by the patient.
Like for a disease or something.
Say it again.
Like for a disease or illness, like you can control that.
Okay, yes, that's true. But think about this kind of like, I guess, before there's a disease or illness, right? These are all factors that like necessarily might lead to a disease.
What about like environmental factors? Would that be non-modifiable? Like if they grew up in an area with pollution, for example?
Yeah, I mean, that is non-modifiable if you don't have the means to move, right? Like that's so in some sense, yes, that's definitely can be considered non-modifiable. So that's a good example there.
And then also depending on where you live, if you don't have access to like clean water, I guess.
I was about to say, yeah.
Mm-hmm. Yeah, that's good, right? So, I mean, if you kind of think about diet and nutrition, sometimes, those you're not able to control those so easily, right? In some instances, sure, yes, you can tell your patient, you really need to improve your diet and that's it. You should expect that. But in a lot of situations, that may not be the case, right? So the idea is we have to be sort of sensitive to things like that, because there's so many things that can impact disease and there's so many risk factors out there. But to just tell your patient, oh, you need to change that, sometimes isn't realistic, right?
I
So
have another one.
Go ahead.
So say like they don't have like say medical insurance, so they don't have access to get like the certain medications that they need.
Yep, that's good too. Yeah, for sure. I mean, and the other thing I was thinking about too, like even just being a child, right? They can't modify their diet, right? It's based on kind of what the parents are feeding them. It's also based on what's available in that community, right? So even though we say diet is modifiable, sometimes it's not really necessarily modifiable. And I think you guys pretty much brought up those same points. All right, so those are just, again, things to think about. And these are things to always think about as we, again, move through and talk about different diseases. All right, let's see what else we got here. The other thing is just to keep in mind the way that the book is structured in each chapter is essentially structured. When we talk about a disease, we'll talk about the etiology, the pathogenesis, and then we'll talk about the clinical manifestations, and then we're going to try to sort of link the pathophysiology to diagnosis and treatment. So it's the same structure every time, okay? So just to talk a little bit about etiology, right? What's etiology? What does it mean? Cause of disease. So again, I think it's still important for us to know these terms, and you may know these already. I mean, you guys, did everyone take medical term already? Are you taking it now or no?
It's in
We take it
October.
second half of the
Oh, it's
semester.
the second half. Yeah. I mean, so you're going to already hear all the medical terms in here, right? And those of you that already work in the emergency room or whatever, I mean, I'm sure you know most of these medical terms as well. And you probably know most of these terms that are presented here, but definitely worth it to just kind of, for this chapter, these main terms that are introduced, you know, make sure you know the definitions, okay? Now, in terms of things that can cause disease, right, we can think of them as exogenous, right, from outside the body, or endogenous from within. And I think I asked, and the same thing in the recording, some examples. So why doesn't somebody give me an example of a chemical agent that might cause disease?
Carbon monoxide.
Yep, carbon monoxide, pretty acute, right? Symptoms that'll form from that. Go ahead, what else?
Lead.
Lead, good. What's another one?
Radiation.
Yep, good. I think we can consider radiation as, is it chemical? I guess it's technically chemical, yeah. What about physical? That sort of leads me to, what are some examples of physical?
Maybe the sun, because it causes like skin damage.
Yep.
A virus.
So a virus you would consider as infectious, but yes, that's exogenous, right? A virus, bacteria, fungi, we consider those as infectious agents, but yep, they're all external. Well, like electricity, fire, right? Any sort of trauma, right? Force is considered a physical type of, obviously, agent. In terms of endogenous, can you guys think of some other examples for endogenous?
Like a compromised immune system.
Okay. Yeah, so I have listed here abnormal immune reactions, but yeah, some other compromise to the immune system.
Would cancer be considered endogenous?
Well, cancer is really the disease, right? But
Mm.
so we're thinking of things kind of that might
Okay.
cause,
Like a certain type of syndrome.
yeah, potentially.
And
And then
then sickle cell.
yeah, so I mean, if you think about sickle cell, that's a result of a gene mutation, right? Gonna cause an abnormal protein to be made that then, right, leads to dysfunction. So yeah,
Would a tumor be one?
say it again.
A tumor.
Well, a tumor is going to be a result, right? A tumor is essentially, you know, we're talking about cancer cells that are going to form the tumor, right? So we want to think about things before that might lead to the formation of the tumor, right? So maybe an abnormal cellular function, right? Cells that are dividing out of control can lead to that. Also, abnormal immune reactions or a compromised immune system can lead to cancer too, right? We mentioned that as well. So there's Good.
Say a chemical imbalance would then lead to like maybe like OCD or something.
Yeah, if you think about psychological diseases, right? When we say chemical imbalance, what do we mean by that? What's imbalanced? What chemicals?
Like an example would be someone who I guess they are I think it's the serotonin reuptake inhibitor doesn't really work or something, and that can lead to mental illness or mental issues.
Yeah, so the inhibitor, right? There's
It's not the chemical
the
itself.
inhibitor, but you're right. The reuptake mechanism or transporter may not work correctly, and then it will decrease serotonin levels. So what's serotonin though? I guess that's what I was trying to get at. What is serotonin considered?
Is it a hormone or no?
Close.
Is it a wait? Is that a chemical or is it a molecule?
Yeah, it's a molecule.
I haven't taken chemistry in a long time.
Where do you find, well, I mean, where do you find serotonin? I mean, actually, you kind of find it in a lot of places, but in general, when we think about serotonin, where do we find it?
The brain.
Yeah, it's a neurotransmitter, right? So when we talk about neurons being able to communicate with each other, they do that via chemical signaling, right? Through transmitters. So if we say you have a chemical imbalance, we're insinuating that your neurotransmitter levels are not where they are supposed to be. Maybe they're too high, maybe dopamine levels are too high, which can lead to psychosis, right? Or serotonin levels are too low. You usually associate that with depression. But yeah, it's super complex, right? And so there's many neurotransmitters, but that's what I was trying to get at. You want to think about that, right? That's internal. So that's good. That was a good example, right? An endogenous agent, right? Meaning like your levels of neurotransmitters are off, right? Or chemical imbalance, however you want to say it. That's a good example.
Wait, so for endogenous, like you can say like stress and depression, like all of that would be considered?
No, so stress you could definitely consider for endogenous because I mean, usually there's some sort of something on the outside that's going to trigger that stress response. But yeah, if you think about the response of your body to stress, that definitely would be considered as endogenous. But then depression, though, again, is a disease. It's a result maybe of the right stress. That agent might then lead to depression, right? Does that make sense? So you want to think about these things we're thinking about are like actual things or changes that might cause something like depression or something like cancer, right? All right, you guys all gave really good examples. So I will move on unless anyone has any other questions. Okay. Just again, remember these terms, right? Idiopathic, causes undetermined. Unfortunately, that is true for most disease, okay? We don't know the cause. In meaning like we can't cure it because we don't know exactly why that change occurred, right? All right, I can kind of skip over this, I guess. Let me just see here. Important here to think about the difference between signs and symptoms, and you guys probably do this like in your health assessment class and things like that, so we can probably move through that. Again, I think I mentioned kind of acute versus chronic. Again, these are just definitions. Make sure we know what they mean, okay, for now. All right, this I'm not going to say anything about. I'm going to introduce the next chapter, which is genetics and genomics. Again, understanding that everything we're presenting here in chapter 1 are broad concepts that are going to really affect every single type of disease, could potentially affect kind of everything that we're going to talk about as we move forward. Okay. So genetics, right? A big sort of hot topic or hot field, I think right now, just in general, in terms of like personalized medicine, right? There's just a lot of sort of, I guess, talk around kind of using genetics more in medicine. So a lot, I guess in the past years, genetics and medicine have kind of been very separate. And so I think we're really trying to kind of bridge that gap and really use genetics knowledge to help treat disease. So it's kind of, it's a very interesting field, I have to say. But anyway, we move on. So again, nutrition is going to impact all kinds of diseases. That's why we're bringing it up here in this first chapter. The other thing that we're going to always consider when we talk about different diseases as we move through are what the book refers to as lifespan considerations. You'll see this kind of in every chapter. And it's the idea like, let's specifically look at the pediatric population versus, say maybe the geriatric population or the pregnant population. Okay, so that there's going to be specialized considerations within those specific populations. Okay, so again, we're not worried about specifics right now. We just want to consider these things. So this is basically just mentioning here, again, this is a congenital defect that's going to be picked up, early on in an infant. Okay, and then hopefully corrected. It usually can be corrected with multiple surgeries. Things like gestational diabetes and preeclampsia. They happen in pregnant women. They don't happen in other populations. Okay, so they are specific to that population. In older adults, I'm sure we can think about things that only affect, I guess, why doesn't somebody tell me, name a disease or something like that that only affects or mostly affects older adults. It doesn't even have to be a disease, but any kind of, I don't know.
Alzheimer's.
Arthritis.
Arthritis, Alzheimer's, good. What else?
Diabetes.
Diabetes. Yeah, you see it as the patient gets older, also younger too, but you're right. That's
Parkinson's.
Dementia.
go ahead. What else?
Dementia.
Yep, dementia in general. Yeah, so like you guys just rattled off a whole bunch, right? So that's the idea, is that these are really more specific to that older population. All right. This next part really focuses on epidemiology. Okay, it's hard. I have to really focus on saying that word properly. But I think what I just want you guys to take away from this is to really understand why it's important to have epidemiological studies, right, on certain disease. Why is it important to know about the distribution of disease? Why do you guys think that's important? Somebody tell me why. Why is it important to know where a certain disease might be more prevalent than others? How does that then impact healthcare, I guess?
Because I know in some certain areas, there's like certain diseases that have never, like, say in like the Asia continent, like there's a lot of diseases over there that haven't really ever touched United States. So
Okay.
you have to see like what causes it, like a disease, like in that certain area.
Well, right. If you see, yeah, so that you bring up a good point, right? If there's a disease in a certain area and not in others, you would probably want to look at the environment there, right? To see what's different about that area versus this area, right? So you can then learn more about disease cause or risk factors or what have you from there, right? So it's important to get that data. So there are, specific scientists who are epidemiologists, right? That will basically focus on that data. And it's super important. And it definitely impacts, everyone in the healthcare field. Obviously we've probably heard a lot of data like that in the last couple of months, right? Lots of epidemiological data on COVID. Okay. All right. So important to just think about the difference between incidence and prevalence. They're different. Incidence, number of new cases. Prevalence is just the number of people in a defined population that already have that disease. Okay. All right. And then also mentioned morbidity versus mortality. Okay. And this is actually, showing you mortality, right? This is from 2015, but leading causes of death in the United States: heart disease, number 1, cancer, number 2. I think that's pretty self-explanatory. The last part of this, and this will lead us into talking about this journal article that I'm going to give you guys, is evidence-based practice. So I guess, why doesn't somebody kind of tell me how they would, or why do you think evidence-based practice is important? Like you as a nursing student, or when you're working as a nurse or you're working as any other type of clinician, why would this be important to you or to your patients?
Because you don't want to make the wrong decision or make the wrong diagnosis, and you want to like make sure people who have like researched this type of disease to tell you what to do.
Good, right? You
want to be, oh, sorry.
Go ahead.
I was going to say, you want to be well informed and know about what the best protocols and best ways of doing things are for your patient.
Very good.
And as working together with team, like working with like physical therapists, occupational therapists, as a nurse, like you want to know like the best practice for your patient.
Yeah, that's really good. So you put that in really good words. So yeah, the idea is, again, I feel like this is more like not really an individual thing, although obviously you as the individual can read as much as you can and learn as much as you can, but it's probably more of a community or sort of department-wide thing, right? Right. You need to talk to, say, a physical therapist or an occupational therapist to know exactly what you should do with that patient if that's within the realm of their expertise, right? And it's super important to be aware of what's new and what people have learned, and that's why people publish papers, right? So everyone can read that, and so everyone should be on the same page, and we all should learn from each other. I mean, that's the way science and medicine works and needs to work, right? Because there's so many things to know. So if you just work in your own little bubble and never pay attention to anything else that's going on, you're obviously doing a disservice to your patients, right? It's not even about like just finding something that's like not easier for you to do, but something that's better for the patient, right? And maybe also easier for you, right? So yeah, so those are good descriptions of that. So the way we kind of are gonna, I guess, bring this into our course is just me giving you guys some journal articles to read. And then we're gonna compile that kind of when we do that final project. So it's not gonna be like, you know, anything too crazy, but I think it's important for us to kind of just be able to read a couple papers and just sort of know what we kind of mean by evidence-based practice. And so we'll talk more about this. And like I said, I'm going to show you guys that. I'll just introduce that paper that I guess I'll do that right now, because I guess that's a good segue into that paper. So I put up a paper on Moodle. Let me show you where. I'll show you where, and then I'll pull it up. So it just says COVID review article, okay? So it's a review article, and what we mean by review article is just that it's somebody wrote it and they're basically reviewing all of the literature that's out there. It's not necessarily a study that they conducted on their own and then are just reporting their results. It's more of comprising kind of all the knowledge that's out there and then, you know, under one topic, and then bringing it together in a nice review so that you can kind of just know what's sort of out there on a topic. Okay, so there's review articles on every topic. So anyway, I thought that's not that. Might be a good kind of place to start. That's the wrong one. 1 second. I guess I have to download it again. I had it somewhere, but it's not there now. Okay, so if you take a look, so it just says here, it's this SARS, the COVID-2 outbreak, what we know, it's from China, right? So it's a Chinese group that wrote it, and they're basically summarizing sort of what they knew up until that point about it, right? So I thought maybe it's kind of nice just to start there. It's actually pretty short too. It's not long. It also breaks it down in terms of kind of how we're going to talk about and think about disease, right? So epidemiology, talks about the clinical manifestations, okay? And again, it's super short and concise, so I thought this was a good place to start, okay? And obviously, this was published in March. There's newer articles and there's a lot more that we already know, and people are writing up papers as we speak, right, about it as well. And so it's always ever changing. So what I want you guys to do just for Monday's class, just read this, maybe take a couple notes, but we'll talk about it at the beginning of class on Monday, okay? I probably am not going to give you a specific assignment for this one. I will probably then give you another article where we would have a more specific assignment on, okay? So don't drive yourself nuts. Just read it and then just be prepared to kind of talk a little bit about it at the beginning of class on Monday, okay? And then, like I said, moving forward, I'll give you more specific questions or whatever related to the article, okay? Does anyone have any questions about that? No? Okay. All right, so that's that. So that's one thing to do for Monday. And then I'm going to introduce chapter 2 real quick, just because I kind of touched on that when we were reviewing about the genetics. So let me just pull that up quickly just to introduce that to you, and I will be putting up that recording. It really is there's a lot of raw sort of biology in here. I know last year when I taught this, we did have to spend a decent amount of time on this, just kind of, I guess, to really kind of learn and discuss the sort of basic, really genetics that's in here, okay? So that's fine. So when I put up that recorded lecture, please listen to it and then jot down any questions or any things that you want me to clarify, okay? I'm expecting that there probably will be more questions on this chapter than obviously chapter 1, because chapter 1, again, is pretty much introductory. But really, talks about genetics and kind of like sort of talking about basic genetics in terms of structure of DNA, right? Purines and pyridamines and the nucleotides that make up DNA, and then talks about, mutations in the DNA, right? So what happens if one of those nucleotides change? What can that ultimately potentially lead to, okay? But then it also talks about something called epigenetics. And so I won't say more about that, but that's definitely a newer field of genetics, and it's super interesting. There's lots of epigenetic, or a lot of research or a lot of evidence that suggests that epigenetic changes can lead to disease. So I've read a paper, and there's a couple papers out there like on Parkinson's disease. So it's not necessarily a change of the DNA sequence. It's other changes related to the DNA that maybe we didn't know about, 50 years ago. Okay. So anyway, that's basically what that chapter, it's completely focused on genetics. Okay. So be on the lookout. I will put that recording up by this weekend, and then I'll also get chapter 3 up by next week as well. Okay. So chapter 2 and 3 will be up by next week so that you guys can listen to that recorded lecture. Now, you obviously, before I put the recorded lecture up, you can always pull the PowerPoints up and start reviewing it. You can start reading the chapter, whatever you want to kind of do ahead of the game, but that recorded lecture will be up for you. Does anyone have any questions? Okay. All right. Now, we're going to try something. So I did this in my last class. We sort of ran out of time, but so I think I kind of told you this. So I will, right before the exam, I will put up an assignment that is basically to submit your completed review sheet, meaning this review sheet with your notes on there, right? Maybe for chapter 1, it's just the definitions of the terms or whatever, okay? For chapter 2, you can see that I have it's a little more detailed, right? So then you might want to add in just some extra information here about the structure and the makeup of DNA, okay? Because I just have that broad kind of outline here, but you want to add in the details to this outline, okay? And I will ask you to submit that, but I'm not going to ask you to submit it each chapter. I'll do it all at once. So what I want to do now, just as review of chapter 1, is really just to kind of work on this chapter 1 review sheet. So in terms of, like I said, maybe we just, to keep it simple, go through the lecture or go through your textbook and just write down those words that are in bold and define them, okay? And what I'm going to do is I'm going to break you guys up into groups, okay? We're not going to do this very long, and then you can kind of finish it on your own and just have this, keep this as your own sort of running document. And like I said, eventually you will be submitting it, okay? You can work on this with somebody else if you want, but for the most part, it should be individual. What I don't want this to turn out to be is you're just copying and pasting things from Google, because that totally defeats the purpose. So that's why we're going to kind of work on it right now. So I guess what I'm going to do is I'm going to break you guys out into groups. It just randomly does that, okay, for you. So just kind of like sit tight. You'll just end up going into breakout rooms. I think you may have to click something to enter that breakout room. I forget, but if it prompts you to do something, please do it. And then one of you or all of you should have this review sheet up on your computer screen, and then just start discussing kind of what definitions you got. So I don't know, I just wrote in random. That's probably not the first one to start with. So probably if you go in chronological order of the chapter or of the PowerPoint, it's probably like pathophysiology, right? Right? And then just basically go in order from there. I think we talked about pathology. Okay, so that's all I want you to do is just add in those terms and then write in the definition. And you guys are going to do this together in groups. And I'll visit into each group to see what you guys got. Okay, so once you enter into those groups, unmute yourselves and talk to each other. All right, and start working on this. So I'll give you guys, I don't know, well, I don't know, maybe like 10 minutes or something just to kind of get started. Okay, I also want to make sure the breakout room thing works. It's also a technology test as well. All right, so let me, I'll stop the share. Okay. All right, so I'm going to send you guys into groups. So it's just random. That's probably too many. Let's see. All right. So there's going to be about 4, let me do that this way, about 3 to 4 of you per group. Okay. So it's going to start doing it now. So just sit tight. So I think it invites you. Yep. gonna go back and get them. All right.
Miss,
What's up?
my laptop stopped working somehow and it just closed Zoom automatically for me. That's why I'm not in a group.
Oh.
And my computer this computer doesn't have a camera on it.
All right. Well, I'll put you in a group because you can still talk to them. So I can get you.
Okay, thank you.
Mhm. She was a great guy. What's that dog? Can you feed the dog, Mace? Well, when you're done, feed the dog. Mesa, I have to go finish doing something with my class, and that's super loud. So. You're done feeding them.
Oh, I got my connection went and it got kicked I got kicked out of the group, I guess. Oh, I think you're on mute.
I can put you back in. Which one were you in? I'm just finishing up anyway, but go ahead.
I was with Jaylene and Alicia.
All right, I see. Yep.
All right, thank you. I'm sorry.
No, it doesn't matter. But then it's funny, if I'm in another group, you can't oh, maybe you could have, I don't even know how to ping me.
Exactly. I didn't know what to do, so I was like, oh, I'll just wait a little bit.
I don't know what you can do. You should be able to I wonder, you know what, maybe next time you can go in the chat and I could see it, but I don't even know. Anyway.
I sent something to the chat, but I wasn't like, oh, maybe because she was in a different group.
Yeah,
so.
Yeah, that's weird. I don't think I can see it. All right, anyway, I'm going to sign you back in there, okay?
Thank you.
Wait, so it's just us?
I guess they did leave because it's only us.
It's recording too, so I don't know if I can't see myself right now.
Wait, was it recorded in the break rooms too?
No.
Not.
Oh, okay, because I would have been concerned. All right, let's just leave. I'm gonna ask her to delete.
All right, bye guys.
Okay, bye guys. Have a good day.
You guys can sign off as you get back in here. I just wanted to get everyone back and just check how this technology works. If anyone has any other questions about anything, feel free to stay on and ask. But otherwise, I'll see you guys on Monday. Okay. So remember that chapter 1 review, part of that review sheet should be completed. Read that article and then be on the lookout to start, listening to chapter 2. And we'll be starting that on Monday. Okay. We'll probably do a case study or something too. All right, guys. As you guys come back, you guys can sign off if you want. We're all done. I'll see everyone Monday.
Bye, thank you.
Bye.
Thank you. Is there anything to do for next week aside from the second lecture and the article?
And then just make sure what you guys were working on, that chapter 1, the part 1 of your review, that's done. I kind of already checked that, so I may not even go back to that on Monday, but yeah, just make sure that's done. So you kind of make sure you got everything with chapter 1, but read the article, right, and then start chapter 2. And we'll be talking about chapter 2 on Monday.
Okay, thank you.
You got it.
And then we have that quiz on Monday, right? So like, when will that be available?
Oh, wait, did I say it was Monday? I'm probably going to do it on
Wednesday.
I'll remind everyone. We're going to probably do it right at the beginning of class together. I may not do that for all of them, but I probably will do it for that one. Yeah, you're right. I did put that. I think so that's what we're going to do. I'll send an email to everyone like right after we get off, just reminding everyone of that. All right. That's the story. We'll do it quick.
So for the article, you mentioned that there would be like a worksheet for the article.
There
Would
won't
it
be for that one. I'll do it moving forward. Like I'll basically in Moodle put an assignment in there, and then I just ask you to answer a couple questions related to the article, and it's like essay question. But for that one, I'm not going to. I just wanted to kind of just start with something and just keep it like sort of laid back, and then I'll give you another one that's kind of like a more specific type of article.
Okay, so for next class, we'll be talking about the article that you gave us just now, plus chapter 2. So that would just be the main focus.
Correct.
Okay.
And then we will have a quiz. Somebody actually just brought that up. Chapter 1 quiz. And I'll send an email to all you guys to confirm that. But right at the beginning of class, I will probably just have you guys all just do that chapter 1 quiz. We'll quickly just go over it, and then we'll move on to chapter 2. Essentially, we'll probably look at the article first and then move on to chapter 2.
Okay, that's fine. Thank you so much.
Got it.
Thank you.
Sure. Thanks.
Are we done? Or are we still in a separate room? Oh, sorry.
You must have kind of
I was writing something down.
We're all done. So you can sign off unless you have questions. Yeah, sorry about that.
I'm good. Thank you. Have a good weekend. Bye.